Well, hello, neurodata refiners. We're back and we're talking about our grand adventure of trying to restore people's brains. This is going to be useful, we hope, for people who are going into some difficult situation, like for the military before they're deployed. We could back them up, understand what their brains are like, and then when they get back, if they, for example, have experienced some trauma or now have PTSD, we'll try and restore their brain back to what it was. People with postpartum depression, we can do the same thing before they have their kids. Or maybe people with seasonal depression, we could back them up in October and then come November or December, try and restore them back to the state they were in. We've been talking to you for the last bunch of weeks about various technologies we're going to be using. We've shown you that transcranial alternating current stimulation specifically works for restoring brains, and we've got some other kinds of technologies for restoring bodies. Kym, who is right here, is a world expert in brain neurofeedback. And today we're going to be talking about neurofeedback. We're going to be countering neurofeedback to brain stimulation in this trial, giving some people actual stimulation and letting some other people do it themselves using neurofeedback technologies. So we thought we would talk to you today about neurofeedback, what it's useful for, what Kym has found so far, and then we're going to demonstrate a fairly new neurofeedback technology with functional near infrared spectroscopy, which Kym has never used before, and we'll see how she does with it. So to get started, do you want to just introduce yourself for those who don't know you very briefly?
Sure. I'm Kym Young. I'm an associate professor of psychiatry here at the University of Pittsburgh School of Medicine. And for the past 10 years, I have devoted my life to amygdala neurofeedback for depression and testing and developing that as an intervention. And so I thought I'd start with just kind of a 2-minute pitch for what neurofeedback is and why you should care for a kind of a lay audience. And so this is an intervention for depression that, I should be able, I can't see, that is non-invasive. I can't see my slides. I'm sorry.
Do you want to move
Can we
over?
switch?
Let's switch.
Sorry about that. Didn't think
We're great scientists.
great planners. Non-invasive has no side effects as long as you are cleared for MRI. Involves no exposure to negative stimuli and no need to talk to a stranger about your mother. Increases feelings of self-efficacy, which we know is related to improvement from psychiatric symptoms, and is an approach that's been based on the decades of research we've done using neuroimaging into the onset and recovery from depression. And this intervention is amygdala neurofeedback, or as I like to call it, pixie dust for the brain. And where this came from was that one of the first talks I gave, somebody gave me a little snarky comment and said, oh, it's Peter Pan, think happy memories and you'll fly. And I've actually run with this metaphor, because if you think back to Peter Pan, if you think happy thoughts and jump out a window, you better hope there's someone there to catch you because you're falling. You are not flying. Instead, when you jump out a window thinking happy thoughts in the presence of pixie dust, that is what allows you to use those happy memories to fly. Similarly, when you have someone with depression and you tell them to think of a happy memory to repair their mood, you actually make them worse. Instead, if you ask them to recall positive memories while bringing the amygdala online, they're able to use those happy memories to adaptively function in their daily life or to fly. And this is just a statistical model that shows this more scientifically, that the relationship between increasing positive memory recall and improvement in depressive symptoms is mediated by that amygdala, that you need to bring your amygdala online to derive the benefits from positive memory recall. And in 2 of the randomized clinical trials we've done, we've had large remission rates. After 2 weeks, it was 30%. When combined with CBT, 1 year later, it was over 80%. And our number needed to treat is under 4. So that's really kind of a brief little breakdown of why I've been doing amygdala neurofeedback for the past decade.
Well, that's amazing. Do we think it helps? Who does neurofeedback help in general?
So neurofeedback seems to help patients with depression. We've had people try it with PTSD and anxiety, and it helps their associated depressive symptoms, but doesn't actually help with their PTSD or anxiety symptoms.
Okay, for amygdala neurofeedback specifically.
Yes.
Now, there are other kinds of neurofeedback.
Yeah, there's a lot of neurofeedback out there. For PTSD specifically, there's been a lot looking at amygdala downregulation to negative stimuli. There's interventions out there for addiction and craving, decreasing reactivity to those addiction producing stimuli. There's neurofeedback for schizophrenia, which tries to reduce the activity during auditory hallucinations. So there's a lot of different interventions out there for a lot of different disorders that are currently being researched. Nothing's been really approved yet.
Right, but research is suggesting these kind of work.
Yeah, research is suggesting that they work, and they work quickly. That's one of the great things, is that with 1 or 2 sessions, we're seeing people improving 3 months, a year later. So it's a really powerful intervention.
Now, is all of this in neurofeedback just fMRI, or there's some other technology?
No, there are several technologies out there. fMRI is what I use, and that's because with fMRI, we can really look at the deep structures of the brain, such as the amygdala, which is what I've been interested in with depression. But there's also EEG neurofeedback. Mm-hmm. Now, EEG is different from MRI. It's got a much better temporal resolution. You get information much faster, but the spatial resolution isn't as good, so you can't actually get to the amygdala. So a lot of the EEG neurofeedback studies are targeting prefrontal cortex regions to teach people to regulate those regions to then gain control over the deeper limbic structures.
So let's just unpack this a little bit. The prevailing theory is that one of the ways that we regulate our amygdala is through the newer parts of our brain, like the prefrontal cortex, that says, let me do what I want to when I want to. And if that's to be more emotional, the prefrontal cortex could drive up the amygdala, or if I want to be less emotional, the prefrontal cortex might drive down the amygdala.
Yeah, and so people have done EEG neurofeedback. The one caveat I would say is that EEG neurofeedback takes longer to learn. So with fMRI neurofeedback, we can usually see people learning to regulate in a single session. Mm-hmm. With EEG neurofeedback, you tend to see people needing multiple sessions before they're able to gain control of that signal. They need more practice.
So, and this is to gain control of a specific brain area. And I think with EEG, as we've talked about, there are specific frequency bands, so a specific brain area or a set of electrodes with a specific frequency band might take a few weeks.
Yep.
We are thinking that we could do this much faster, right? And with EEG. Why is that?
Because we're not targeting, rather than targeting a kind of average or what we've determined to be normal, we're actually trying to get people back to where they started. And so we're looking at we're trying to match their brain activity to where they were previously. And so rather than gaining control of a signal that you've never necessarily experienced before, you're trying to get back to a state where you were before. So we think that'll be faster and easier to learn.
Right. So just to unpack that for a bit, we've measured people before, and we're not trying to get them to some canonical brain. We're not trying to get them to some state that they have no familiarity with. This is, we just want you to do the thing that you did yesterday. And to do that, we're going to give you a thermometer to say how close you are to where you are yesterday. And I think this is really extraordinary for neurofeedback, specifically because so many of the people we talk to say, I don't remember where I was yesterday. Now that I have PTSD, I don't remember who I was before I had my trauma. Now that I have postpartum depression, I don't even remember who I was before I had my kid.
One of the most common things I hear from our patients with depression is that I have no happy memories. I can't remember anything happy. And when they actually get into the neurofeedback, it turns out they do have those memories. They just have difficulty accessing them. And so we're helping them access them.
So if we have a thermometer saying, well, you're this close to yesterday's memories, if you just increase this a little bit, you could be a little bit closer. That's very different than say, please increase this arbitrary brain area. You don't know what it does.
Yeah.
So that's a really interesting idea. We're going to be contrasting in this study neurofeedback to this direct brain stimulation where we stimulate you with yesterday's brain. Why are you so interested in that contrast?
So I'm really interested in the neurofeedback aspect because there is this enhanced feeling of self-efficacy. You learn how to make yourself feel the way we're trying to make you feel. And so this enhanced agency and self-efficacy has been shown to be really related to clinical improvement. And so I think that learning what you can do, what strategies work for you to get your brain to that state is a really effective way for long-term learning, so that when you're out of the scanner or out of the neurofeedback situation, you're able to recreate what you were doing during the neurofeedback session.
And if people can do this, it's going to be amazing.
Yeah.
I think the transcranial alternating current stimulation is a great way to go. It's also quite expensive. It is hard technology to use. If people can do this on their own, EEG is so ubiquitous at this point.
Yeah. And EEG is just so easy, and now there are EEG systems out there that are commercially available. That it just, if we could get people to do that on their own, that would be a really easy way to translate it.
And I should say we've had some luck with that. We had one person, I think may have mentioned it on this podcast, who came in when she was feeling good about her thesis and knew that she soured on things. And so she said, "Rack up my brain now." 3 months later, when she was predictably upset about her thesis, she came back in, and we just neurofeedbacked her to that previous state, and she became happy, and she said, "I remember why I liked my thesis." So this is what we're hoping to try and replicate, but in a study rather than just a series of cases.
Yeah.
To give people an idea of what it's like to just start out with neurofeedback, though, I do have this toy, or device. It's by a company called Mendy. I have no affiliation with them at all, but it's Functional Near InfraRed Spectroscopy. And do you want to say what that is?
So that's a third technology that's kind of in between fMRI and EEG. It has better temporal resolution, and it actually looks at blood flow, whereas EEG is looking more at electrical activity. But it still, you can't get to those really deep structures.
The way it looks at blood flow is very simply it shines a light through your head. And just like your mom told you, if that light comes out the other side, there's not much going on. But if blood is flowing, that light is occluded, and we can conclude there's blood flow.
Yeah.
So here are the little lights that it's going to shine, and it's got one on the left and one on the right. We get left and right signals, which it's going to average. And I can show you what it does very briefly, and then we can let you try it as well.
Yeah, I've never tried it before.
So the setup is incredibly fast. That's it. The app is on an iPhone, and I'm just going to say start training. It wants to connect. Turn it on. It says it's connected. I'm going to start out, and so it's going to say turn my screen here, and you can turn my screen so you can see the screen turned there. It's going to calibrate, and the calibration is just to unfocused, not working at neurofeedback. And then everything is changed from that baseline. So now we have this little ball that is rolling along. Could you hold that a second? And so now the goal is to make the ball go up. And if I just start thinking about the ball going up and I raise it, and I like this physical metaphor, I can feel and see the ball go up. Oh, it started to come down. So I take a break, take a breath, and I'm going to push it again. And it's going to go up. And then it's going to come down, take a break, take a breath. Let's try and bring it back up. Come on, you can do it. You see it going and going. There we go. And it's like that. So I'm going to stop it there. And I will give it to Kym. And what I will tell you is it's measuring a brain area called BA10, right in the frontal polar region, that is associated with positive affect, it's associated with focus, and it's associated with specifically not ruminating on negative things so much as focus on the ball.
Focus on the ball.
and focus on the ball going up, the more happy you are about the ball going up, the more positive affect for a thing you are doing. You get this feedback of, I'm doing this thing, I like myself, and the ball is going up, and that's what'll make it continue to go up.
Okay.
Now, you want it to be maximally different from the calibration period. So during the calibration period, if you're unfocused and slightly sad, then you have the best chance of, or unfocused and at least, letting your attention wander to maybe some negative things, you have the best chance of it going up when you're doing the neurofeedback.
Okay.
Your head might be a different size than mine, so you can adjust it.
Okay. And I should say, I've done fMRI neurofeedback a lot and learned how to master that, so it'll be very interesting to see what happens when I try this new technology of neurofeedback. It fits.
It fits. Great. So, I'm going to increase the volume so you can hear the little music that goes with it. And we're going to start training. Okay, so here we go. And you can see the ball. Oh, it's calibrating now. So this is your unfocused negative. All right, and now you see the ball. There you go.
There we go.
All right, let's stop it there. That was, for a first time, amazing.
We will say I am kind of a neurofeedback expert with
Yeah.
fMRI, so I think I wasn't not surprised that
You
it was
can take the toy off.
that it was easier for me to do than maybe some people.
Yeah. So what I like about it, you saw it did not take 10 training sessions.
No, it didn't take 10 training sessions.
And you got a sense for what was making it go up and not go up.
Oh, absolutely.
What was it like when it would go up versus when you when it?
So it went up when I started thinking about happy memories and trying to will it. So my happy memories are always my cats, cats and friends, and so I was experimenting and I would start thinking about my happy memory, and then I would stop. And just kind of relax, and that's when it would go back down, and then I'd start thinking about a different happy memory, and it would go up. And what I also love is that it's instant. It's right as soon as I'm doing something, I see the effect. Whereas with fMRI, there's something called the hemodynamic delay, where there's actually 6 seconds of delay between what you're doing and the effects that you see. So you have to kind of keep in your mind what you were doing 6 seconds ago to determine what's effective. And I really like that it's just instant.
Yeah, I feel like it's a lot like the signal we go for. It's a little different, but it's close enough. And I'm really enthusiastic about this as positive affect neurofeedback.
Yeah, that was fun.
Yeah. And so where we go from here, whether we use devices like this or more EEG-based stuff, we're going to see as time evolves. And speaking of that, it's about our time. So thank you for tuning in with us this week. And we'll be back soon, and we'll show you what we're getting as we evolve this project. Thank you all, and goodbye, NeuroData Refiners.